Mental health facilities are calling on the government to close the treatment gap and deliver on children's right to mental health services. This call for funding comes as South Africa observes Child Protection Week and the Youth Month. For more on this, we are now joined by Professor Petrus de Vries from the University of Cape Town's Child and Adolescent Psychiatry Department. Professor, thank you so much for joining us this evening. Now, is there a growing concern with regards to mental health conditions, especially among children and adolescents?
Absolutely. And Katlego, thank you for inviting me to join you for this really, really important and I think urgent conversation. So it's absolutely the case. And I'm sure all your viewers and listeners have during COVID realized just how important the mental health of children and young people are. And if we just think in our continent, because I know you also have many African viewers and listeners, if we have a population of 1.2 billion people, half of Africa is a child. So that means we have about 600 million children on our continent. 1 in 10 of them, 10% of children will have a mental health disorder that can be treated if we can catch it and actually get them to appropriate services. So that's about 60 million. That's as many as people as we have in South Africa. And yet we know that probably fewer than 1 in 10 of those children and young people who need mental health services ever receive any diagnosis or any kind of treatment or support to meet their needs. So you can see that's why we're saying at this point in time, Youth Month, Child Protection Month, come on people, we need to sit up and really pay attention and think what we as a whole society and as governments can do to reduce that gap.
And in paying attention, Doc, or rather Professor, which children in terms of race, age, class are more prone to these mental health conditions?
You know, Katlego, the interesting thing is that mental health does not discriminate. It affects all young people of all races and ethnic groups, of all languages, of all parts of the world. And that's one of the striking things, which means it's everybody's problem and it's therefore everybody's business. What we do see, and that is part of the challenge in a place like South Africa, where we still have the legacy of apartheid, is that the young people who get access to some of these supports tend to be those who are English-speaking, those who are white, those who are from more affluent communities and from highly educated families, which means the discrepancy that we already have is getting accentuated when we think about these sorts of child and adolescent mental health problems.
So what should parents be looking out for then, Prof, in order for them to know that they need to seek professional help?
So just very simplistically, if I divide it into two main groups, when we think about young children and preschool and early school age kids, we have a group of conditions that we call neurodevelopmental disorders. So those are things like autism and intellectual disability, ADHD. So these tend to be conditions of the growing brain. So what mums and families and aunties and often it's grannies will see is that the child just doesn't develop as they would expect. They don't seem to be able to develop language or make friends, or they're very overactive, or they don't seem to be able to engage with other kids in school. So by the time they get to creche or school, often it's the teachers who would say to families, "Oh, we're a bit worried about this child." So that's the kind of neurodevelopmental group. And those are hugely important because if we can catch them early, we can treat them as well. And then the next group in the kind of school and teen years, this is when we often start to see depressive symptoms, anxiety symptoms. So for mums and dads and families, it's children who start to show less pleasure in the things they used to, start to become tearful, who withdraw, who are too anxious to go to school or don't want to mix with their peers, etc. And that's also the age we might start to see things like substance use. So young people starting to use alcohol or other kind of substances, getting in trouble with the police. So any of these are possible things that might make a family think, oh, I think we should try to think perhaps there's a mental health condition that we should find some next step in terms of what we can do.
Right. Now, Prof, earlier on you alluded to the contributions of government with regards to this problem, and we know that government recently released a national mental health policy. What is it about this policy that sort of gives us a light at the end of the tunnel that we could possibly start dealing with the problems that we have when it comes to child and adolescent mental issues?
Katleho, I wish it is really a light at the end of the tunnel. I mean, I want to be an optimist like you. But if we just for a moment put this all in context, for most of the last century, we focused on thinking about HIV and TB and infectious diseases on our continent. And if we think about mental health, there are actually more mental health conditions than there are children who have TB or HIV if we put them together. So it's such a major problem, and it really is such a concern to us that governments haven't listened. So yes, we now have a new policy, but what often happens is that child and adolescent mental health is kind of hidden inside that. We also know that the South African government, but also many African governments, have a lot of pressure on their budgets. So they're squeezing the already limited funds and the resources. And so what we're trying to say with this press statement by the group of organizations to say, we really need government, South African government and African governments, to make child and adolescent mental health an absolute top priority, and that they should start investing in child and adolescent mental health services in a very targeted and a very systematic way. Otherwise, we really are at risk in a continent that's young and that's growing of really, really causing significant harm to young people.
And in addressing that, Prof, what would you say are the most practical steps in our government ensuring that they start that investment within the healthcare facilities, especially for public healthcare, as you mentioned earlier on, that it's children in the private healthcare that have that access?
Yeah, and look, I have to, just another shocking number. In the whole, I've said there's probably 60 million children in Africa who need some mental health support. In the whole of sub-Saharan Africa, we only have about 70 or so child and adolescent psychiatrists, and which means most countries on our continent don't even have one child psychiatrist. So, yes, we really need to think how we can get governments. I think, well, the short answer of what our governments need to do are, number one, once they've said this is a priority, and it has to be a priority, then we need to invest in what I would call a pyramid of care. And so that means at grassroots level, in the community, we need to do awareness raising and training of what families and what people can do at home. Because for many of these conditions, there are lots of things that mums and dads and grannies and aunties can do to help identify and support children and young people. The next is then we need to train people in primary care level, the nurses, the community health workers, the medical officers, wherever they are in the country or across Africa, so that they can identify and treat the things they can. Then, and this is the big thing that I think needs to be different, we need in every district of our country and in every district of Africa, there needs to be a child and adolescent mental health team of people who can identify and treat and work with young people and their families in their own communities. And that's the key. These things affect whole communities, so we need a whole community response as well. And then, of course, the government needs to continue to support specialist services. We have so few specialist services. You've heard 15 child psychiatrists in the whole public health sector in our country. Now, that's a terrible number. We need enough of those expert people who can supervise, train, support, and, very importantly, Katleho, I think, we then need to make sure that we also do research about child and adolescent mental health problems and their solutions in Africa. Because we can't assume that the things we learn from the USA and other rich countries of the world are the same, and that the solutions, therefore, may be the same. I think Africa is such a vibrant and interesting continent. We need to find new solutions and new ways of working with families and young people to find a solution to, and a creative solution to this really, really important challenge we have on our continent today. In
finding those solutions, Prof, you mentioned earlier on that 1 in 7 children have a treatable condition of mental health illness. In the situation where we are lacking these resources, what's the impact of a child not having been treated when they are then now an adult?
Yeah, look, almost half, if not more than half of adult mental health problems start in young people, start before the age of 18. And when we can, let me start by what happens if we don't catch it. We have all sorts of secondary impacts. So it has an impact on the child, the young person, but it has an impact on their educational opportunities. It has an impact on their family because they live with a family. And many of them, if they're not treated, then go on to develop adult and often hard to treat mental health conditions. They struggle to find jobs. They often get into criminal behavior or in trouble with the police. It has a huge societal and economic impact. So just to turn your question perhaps the other way around, if we can get the investment, if we can get people to say, gosh, child and adolescent mental health difficulties is the 21st century challenge, like we struggled with HIV and TB in the previous century. And we can improve the quality of life for the child. We can improve their ability to go to and manage in school. We can improve their family's ability to keep their jobs and stay in their jobs. And we can improve the whole quality of life of that whole community where people live. And ultimately, and that's why I hope the World Bank is also joining our forces, ultimately, it has, if we can find and catch these child and adolescent mental health conditions early, it will have a major positive impact also on the economy of our countries.
So, Prof, are there any countries then that our government could mimic from that are currently getting this right, especially when it comes to children and adolescents?
Unfortunately, the countries that are examples are very much the high-income or rich countries. And therefore, it's very hard for us to say, let's try to learn from them. I think that there's enough knowledge and skills and data and expertise within our own country and within our own continent. Our task now is to find a way of really collaborating with our governments to implement the things that we know and the things that we are learning from Africans. As I said earlier, we really need to make sure that we bring African solutions to African communities.
All right, Prof, thank you so much for your time this evening. It really has been very informative and certainly an important discussion that we should be having and pushing for our governments to take care of our young ones. Thank you so much for your time. That was Professor Petrus de Vries from the University of Cape Town's Child and Adolescent Psychiatry Department.